الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Parasites transmitted from animals to humans by Professor Mahmoud Hani Sulaiman. List of these parasites: Fasciola hepatica, hydatid cyst, Hymenolopus nana, Heterophis, Tinea infection. Sheep liver fluke, Fasciola hepatica. Organism: the sheep liver fluke, Fasciola hepatica, less commonly Fasciola gigantica. Fasciola: geographical distribution, gigantica, cattle raising countries, hepatica, sheep raising countries. Both exist in Egypt. Worldwide distribution in sheep rearing areas, especially Andean highlands of Bolivia, Ecuador, and Peru, Nile Delta region of Egypt, and northern Iran. F. gigantica is found in Africa, Western Pacific. 2.5 million are probably infected in world, with up to 60% of population in high endemic areas. Transmission life cycle. Eggs pass in feces, liberate a miracidium on contact with water. Miracidium searches for and invades snails of genus Lemni. After passing through sporocyst and radia stages, Cercaria insist on grass or water plants. Normal life cycle is in sheep. Humans incidentally infected when contaminated water plants are eaten. Cattle and goats also act as reservoir. Life cycle of Fasciola: man, infected man and infected herbivorous animals. Then it goes in man to the bile ducts of liver. Present in feces, eggs, contaminate fresh water, egg hatching miracidium, which search for snail. 4. gigantica and 4. hepatica. Leptocerrus cercaria out from snails with simple tail, gives to encysted metacercaria and go to the water and vegetables ingested by man. So the man is the definitive host. The animals are reservoir host. Bile duct of liver is the habitat. Egg is the diagnostic stage. Intermediate host is the snail. Infective stage is encysted metacercaria. And mode of transmission by ingestion of contaminated vegetables and drinking water, contaminated water. Incubation period, it is months, about 3 months. Period of communicability, not transmitted from person to person. Clinical features: parasite favors liver, piercing gut wall and migrating through liver substance to lie in biliary passage. This migration and residence in liver lead to extensive damage, which leads to fibrosis and cirrhosis. Clinical picture: digestive disturbances and diarrhea, fever, urticaria, bronchial asthma due to allergic reaction to parasite byproducts. pain in right costal margin and substernal pain in right hypochondrium, enlarged tender liver, cholangitis, cholecystitis, and obstructive jaundice. Diagnosis of fascioliasis. Clinically, fever, hepatomegaly. This is suggestive. Lab, detection of eggs, immunological tests, either coproantigens or antibodies, blood examination, radiology, lab diagnosis, detection of eggs in feces or duodenal aspirate. This is how we took duodenal aspirate and how we examine it under microscope to find this egg. The size of it 140 by 70 microns. Its shape is oval, operculated, thin-shelled, yellowish, immature oval. Treatment: generally ticlopandazole 10 mg per kilogram single dose, which can be repeated after 12 hours, single dose. Prevention and control: generally mass treatment, proper washing or cooking of aquatic vegetations, soaking of vegetables in vinegar or potassium permanganate. Solution: safe water supply, snail control. Sheep should be examined at regular intervals and treated if found to be infected. Fish transmitted liver flukes, heterophis. Causes: geographical distribution, Middle East and Far East. In Egypt, lakes of Manzala, Borollos, Bardawil, and Qarun. This is the adult, and this is the adult embedded between villi at the left of small intestine. This is the bolty, this is buri, which harbor encysted metacercaria. Life cycle of heterophis: infected man and fish eating animals, egg and stool from man and animals, and go to brackish water. Egg is swallowed by snail, Perinella conica. The cercaria go out from the snail, Lophocercus, with a tail and membrane. Infected buri and polti, encysted metacercaria inside them. Ingestion of insufficiently cooked infected fish. So man and animal is the final host. Egg and stool diagnostic stage. Snail is the intermediate host. The infective stage is Lophocercus cercaria and encysted metacercaria inside buri and bolti, which is the second intermediate host. If eaten by animal and man, they get infected and the cycle is repeated again. Clinical picture: abdominal discomfort, colicky pain, mucus. Adult fluke lives in branches of bile duct, which leads to trauma and inflammation, dilation of biliary system, distortion of liver architecture, which can lead to biliary stasis, hepatic engorgement, fatty infiltration, and finally cirrhosis. It is a risk factor for cholangiocarcinoma. Migration of flukes up pancreatic duct leads to damage of pancreas, which lead to recurrent pancreatitis. Lab diagnosis, detection of eggs in stool. Its size is 30 by 15 micron. Shape oval, thick shelled, operculated at one pole and had a knob at the other pole. Yellowish brown, mature miracidium. Blood examination, eosinophilia. Treatment, praziquantel. Transmission of this disease, humans infected by eating raw fish, either pickled, smoked, or undercooked fish. Eggs passed in feces develop into miracidia, which is swallowed by snails. This pass-through sporocyst leads to radial stages in snail and produce free-swimming cercaria. Seeking out a suitable fish, cercaria penetrate between scales and insist in flesh. Parasite also attacks dogs, cats, rats, pigs, which form reservoir of infection. Incubation period, 4 weeks. Period of communicability. Egg may pass for 30 years, but reservoir animals are also an important source of infection. Occurrence and distribution. Distribution is very similar to Fasciola being found in China, Japan, Korea, Taiwan, Thailand, Laos, Cambodia, and Vietnam. Lower Mekong Valley. 30 million people suffer from the disease. Prevention and control. Prevention is by proper cooking fish, other foods as fish paste, often added to food after it is cooked to improve taste, are made from raw fish and are a potent source of infection. Prevention detailed fish eating animals, birds, and fishermen in fishing trips pollute brackish water and lakes. Food habits must be changed. Proper cooking and salting of fish. Periodic examination and treatment of fishermen. Health education. Snail control. Treatment, praziquantel 25 mg per kilogram 3 times per day for 2 days. Surveillance. When a case is identified, search should be made for the accused food source. Hymenolepiasis, Hymenolopus nana and Hymenolopus diminuta. Both are cosmopolitan in their distribution. Nana more common in warmer climates. Diminuta is a common parasite of rats, mice, and only occasionally infects man. How is man infected with Hymenolopus nana? This is the man. Egg of Hymenolopus eaten, go to the intestine. Cysticercoid nana in submucosa. Adult in small intestine. This is the habitat. Small intestine is the habitat. Definitive host is infected human. The egg pass in stool. Diagnostic stage and infective stage is Hymenolopus egg nana in stool. This is the rat and the rat flea. Cysticercoid nana in rat flea. The egg either eaten or the flea. In H. nana there are 2 infective stages. Egg of nana and cysticercoid nana in rat flea. Mode of infection. Ingestion of nana egg in contaminated food or drink. Hand to mouth auto-infection. Ingestion of infected flea. How is man infected with Hymenolopus diminuta? This is the man. This is the rat flea. Cysticercoid inside. He eats the rat flea, goes to small intestine. Infected man is the definitive host. Egg pass in stool. one infective stage only in diminuta. Pathogenesis and the clinical picture of Nana, commonest tapeworm affecting Egyptian children. Light infection asymptomatic, heavy infection, intestinal disturbances in the form of abdominal pain, loss of appetite, diarrhea and vomiting, nervous manifestations due to absorption of toxic byproducts of the worm. Child suffers from dizziness, insomnia and convulsions. Diminuta and caninum, asymptomatic intestinal disturbance. Diagnosis: stool analysis to detect H. nana egg, diminuta egg, caninum egg. Nana egg about 50 microns size, shape spherical, two coverings, inner with polar prominences, translucent, the color, hexacanth oncosphere. The diminuta egg about 50 micron, spherical, two coverings, inner with polar prominences. Yellowish hexacanth oncosphere. Caninum 5 to 15 eggs enclosed in part of uterine wall. Treatment: the three praziquantel. Treatment in Nana is repeated after 10 days to guard against autoinfection. Treat all members of the family at the same time. Prevention and control, elimination of arthropod, rodent control, personal hygiene, environmental sanitation. Epidemiology: the dwarf tapeworm Nana is found in most warm regions of the world. It is most common cystode infection in southern eastern United States, Latin America, and is common in southern Europe, Russia, and the former Soviet republics and Indian subcontinent. Young children are particularly troubled with H. nana infections, especially when many worms are present. Clinically, loose bowel movements or frank diarrhea with mucus but no blood, diffuse persistent abdominal pain is the most common complaint. Pruritus in eye are occasionally encountered. Children have sleep disorders that clear after therapy. CNS symptoms as seizures is reported. Moderate eosinophilia about 10% and skin eruption. Diagnosis: ova and stool. Stools of entire family must be checked. As in all tapeworm infections, post-treatment stool examination should be done after 5 weeks and after 3 months. Treatment and prognosis: praziquantel, single dose of 15 mg per kilogram body weight, eliminates adult worms but also kills larval stage. Treated individuals have an excellent prognosis. Prevention and control: this infection is hand-to-mouth disease, therefore extremely difficult to control. Education and hygiene is probably the only practical way to reduce the incidence. Summary: occurrence worldwide, organism Taenia solium, Taenia saginata, Cysticercus cellulosae. Reservoir: humans, transmission uncooked meat. Autohuman infection, cysticercosis. Control: personal hygiene, individual specific treatment, sanitary disposal of feces, thorough cooking of meat. Tenias occurs in all countries where beef or pork are eaten. The larval stage of Taenia solium produces cysticercosis. Clinical features of Teniasis are often absent, the patients only becoming aware of the worm infection when segments passed in stool. Taenia causes Teniasis saginata and solium. Geographical distribution: cosmopolitan. Saginata where cattle is present, solium where pig is present. the worm is about 10 m long, the solium about 4 m long. Definitive host man. Cysticircus bovis in the saginata. Intermediate host is the cattle, ingested in beef, go to the intestine, segments pass in stool, egg pass in stool. Solium due to pigs eat the eggs. Cysticircus cellulose, intermediate host are pigs. Cysticircus cellulose ingested in pork. Tinea solium go to intestine. Epidemiology. Beef tapeworm Tinea saginata has a cosmopolitan distribution common in Middle East, Kenya, Ethiopia. World incidence of Tinea saginata is much higher than that of Tinea solium. The pork Tinea solium is also widely distributed in Central South America and Africa and Southeast Asia. Its larval stage, Cysticircus cellulose, produces cystocirrhosis in man. In several countries, e.g. Ecuador, prevalence of human neurocystocirrhosis is high and constitutes a serious public health problem. In some parts of Kenya, Teniasis infection rates in man reach 100% and 30% of cattle harbor cystocirrhosis. Reservoir and transmission. Humans are only reservoir of infection. Humans acquire Tinea saginata infection by eating raw or partially cooked beef. Cattle infected by grazing on pastures fertilized by human feces or irrigated with sewage-laden water. Tinea solium spread by insanitary disposal of feces, so this leads to pigs infection on ingesting human excreta. A man infected on eating uncooked or undercooked pork. Role of birds in transmission of disease is clear. Lab diagnosis. Direct smear exam of feces reveals typical tinea ovum. Intact segments passed compressed between two glass slides and branches of uterus at their origin from main uterine stem counted and a differentiation. Tinea saginata about 35 branches, Tinea solium about 12 branches. ELISA and PCR technique for saginata eggs and proglottis. Diagnosis of tinea. Detection of eggs and gravid segments in stool. Staining of eggs with Zell-Nelson stain. If they are stained, they are saginata. If unstained, they are solium. Detection of motile segments under clothes or on bed in saginata. Cystocirrhosis diagnosis. Calcified cysts can be seen radiologically while CT and MRI replaced older methods. Complementary procedures are ELISA and Western blotting. Biopsy of palpable subcutaneous nodules. Diagnostic. Prevention in the individual. All persons suffering from teniasis dewormed with niclosamide, single dose of 2 grams, or praziquantel, single dose of 5 to 10 milligram per kilogram after light meal. Thorough cooking of all beef and pork meat offers personal protection. Health education done to increase standards of personal hygiene, especially among persons harboring Tinea solium. Treatment of cerebral cystocirrhosis includes praziquantel, albendazole, steroids, and surgery. The community prevention among community. Sanitary disposal of human excreta. Human feces used as fertilizer only after treatment. Strict abattoir supervision. It is an occupational disease. In meat containing cysticerci consumed, it is thoroughly cooked with close supervision of health officer. Community-oriented chemotherapy of Teniasolium tenaces with praziquantel introduced to prevent local endemic neurocysticercosis. And thank you. Walhamdulillahi Rabbil Alameen.